Now we will begin today's webinar on Adulting 101. My name is Madison McMahon Ward. I'm the Program Manager for Triage Cancer, and it's my pleasure to introduce today's speaker, Monica Bryant. Monica is a cancer rights attorney, speaker, and author. She is the co-founder and chief operating officer of Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law, an Interdisciplinary Approach. Remember, if you have any questions for Monica during the webinar, please use the Q&A box to send her a question, and she will answer those towards the end of the presentation. So with that, I'd like to turn it over to our speaker.
Thank you so much, Madison, and thank you to all of you for joining us and for your patience with any technical issues we might have today. Mother Nature is getting her last laugh as we in Chicago are getting another 2 inches of snow. So thank you for your patience with that. So today we're here to talk about adulting. And I know that when I'm out talking with people in the community, there seems to be this general sentiment that they're the only ones that don't have it all figured out. But the numbers show quite the opposite. In fact, studies show that many people aren't preparing for the contingencies, and most of the time it's because they just didn't know they needed to. And so we often sort of joke in the office that there should be a class in high school on adulting, on the finances and insurance piece, because it's stuff that we all have to understand and figure out, but no one ever really stops to teach us how to do that. So that's how this particular presentation was born. So there has been a new term in the cancer community over the last couple of years called financial toxicity. And this term was created in 2013 by researchers at Duke University. And in their research, they looked at how the out-of-pocket expenses of a cancer diagnosis and treatment can be as detrimental as the physical toxicity of cancer treatment. And that it's not just about the dollars and cents or somebody's bank account, but that financial burden ends up diminishing people's overall quality of life. So while it's a relatively new term, it is certainly not a new problem. So why is it so hard to address financial toxicity? Well, one of the reasons is that there are multiple contributing factors to financial toxicity. And if we don't address all, or at least most of them, there is no way to effectively minimize financial toxicity. So the 3 sort of biggest factors are health insurance status, and that could mean, do you have health insurance or not? It could also mean, do you have the adequate health insurance for what you need? Certainly the employment changes that can result after a cancer diagnosis can impact somebody's finances. And then all of the life changes that normally impact finances often continue to happen even in the midst of a cancer diagnosis. So things like relationship changes or moving or graduating from school are all going to impact somebody's finances, and they're going to compound the out-of-pocket costs that somebody's dealing with a cancer diagnosis. So this is our checklist to minimizing financial toxicity, and I fully recognize it's really hard to read on the screen. But if you go to the link at the bottom of the screen, and that link will also be available on our website in the resources document in a clickable way, you will get the full-size version of this document. And in that document, it shows on the left-hand side all of these questions that could be asked of someone really at any point along the continuum of care. And then on the right-hand side, it lists all of the resources that Triage Cancer has to help somebody either come up with the answer to the question or deal with the answer to the question. And so we just want people to start thinking more broadly about how to address financial toxicity, and that it's not just about cost of care, that there are these other pieces that we have to bring into the conversation. Now, I mentioned that health insurance is a contributing factor to financial toxicity, but the reality is other types of insurance could be beneficial as well. And collectively, we can refer to this as somebody's insurance portfolio. And really, that's just a fancy term for saying, what are all the different types of insurance does somebody have? Now, there are a couple of different places that somebody can look to find insurance. So sometimes these plans are purchased directly from a company. Sometimes people use agents or brokers to access these plans. Many times, these insurance policies are actually provided by an employer as an employee benefit, and that employer may even contribute to the cost of the policy. And then sometimes people belong to associations. So it could be a religious organization or a professional organization. So for example, as an attorney, I belong to the American Bar Association. And through those associations, you may have access to purchase some insurance policies. So I will absolutely admit this is not an exhaustive list of all the different types of insurance that somebody could purchase, but they're the main ones that I would suggest people consider if they need or not. And that obviously includes health insurance and disability insurance, but also possibly long-term care insurance, homeowners or renters insurance. If you have a vehicle of some type, making sure that that's insured. And then supplemental policies are something that a lot of people aren't aware of, but they're an insurance policy that you can purchase on top of a health insurance policy that helps deal with some of the out-of-pocket costs that might arise if you are diagnosed with a serious medical condition. So one example of this is the Aflac Cancer Plan, where there's all different types of provisions, but for example, if you get certain screenings, you get a $500 check in the mail. If you end up getting a cancer diagnosis and need surgery, for example, you get a check in the mail. Excuse me. Now, that money that you receive from those supplemental plans can be used for any expenses. So they don't have to be used for healthcare related expenses. So when we're talking about how do we help people avoid this financial toxicity, potentially having some of these policies might be helpful. The challenge with insurance, though, is it's really irritating, at least to me, every month to be paying for these policies when you don't really need them. The flip side is you never know when you're going to need them. And for most of these policies, if you don't have them in place before you get diagnosed with a serious medical condition, you're sort of out of luck at that point. So insurance, it's one of those you're preparing for the rainy day situations. Now, in addition to insurance, there are two different accounts that you might have access to. So a health savings account, or an HSA, is available if you have something called a high deductible health plan. And that's a very specific type of plan. They could be offered through an employer. There are some in the marketplaces. But if you have one of these high deductible health plans, it makes you eligible to open up an HSA. And then you can put money into these HSAs pre-tax, and that money sits there. And then you can use that money on healthcare related expenses. What's really great about an HSA is, of course, it's pre-tax. So that's money that you are not ending up paying taxes on, but also it's your account, and those unspent dollars roll over from year to year. Another type of account is a flexible spending account. Now, these are only available if you have an employer-sponsored health insurance plan and the employer sets up a flexible spending account. Similar to an HSA, with FSAs, you put money in pre-tax, and there is a maximum each year, and you can use that money to pay for qualified healthcare expenses, including copays and deductibles. So what's fantastic about these accounts, if you have access to them, is it's that pre-tax money. With FSAs, it is a use it or lose it type situation. So if you don't use everything in the account for that year, you lose it. A couple of years ago, a change was made so that employers now have the option to allow employees to roll $500 over to the next year or a 3-month extension, meaning that you can still use your 2020 FSA dollars through March 15th of this year. And that's going to be specific to employer. Now, the IRS does determine what is a qualifying expense, but a little bit of breaking news is that in the CARES Act, which is a piece of legislation passed to help deal with COVID, Congress actually expanded the qualifying expenses, and they expanded it retroactively back to January 1st of last year. And so it includes many over-the-counter items related to, Band-Aids and viruses and all those sorts of things. It also includes feminine hygiene products. So if you've ever thought about an FSA and thought, well, it's too limited for my needs, it might be worth taking a look at what the new qualifying expenses are. Now, we know that health insurance status is that primary contributing factor to financial toxicity. So that's actually pretty easy to solve. The problem is health insurance is so complicated that Americans simply don't understand how it works or how to choose a plan. This study showed that only 4% of the people surveyed could define the terms used in the policy. So with that knowledge, assuming that only 4% of the people on this call can define the terms, that's where I'd like to start. Now, for the healthcare professionals on the call today, I fully recognize that some of these are old hat to you and you use them day in and day out, but let this be a gentle reminder that your patients may not have a clue what you are talking about when you are using these terms. So when we talk about the costs related to health insurance, there's a cost just to have the policy, and that's your monthly premium. It's going to vary plan to plan, but you're going to pay it every single month, whether you go to the doctor or not. Then there's some additional costs when you use your health insurance policy. So the deductible is a fixed dollar amount. It's going to depend plan to plan, and you have to pay that each year before your health insurance policy starts picking up their share of the costs. Now, you could have a $5,000 deductible, you could have a $500 deductible, you could have a $0 deductible. It's going to depend on the plan. When we talk about the copayment, that again is a fixed dollar amount, and you're going to pay that each time you get care. So it's very common for policies to have something like a $25 copayment every time you see the doctor, or a $250 copayment when you go to the ER. Then there is the share of costs, otherwise known as coinsurance or cost share. And this is actually a percent. So it's the percent difference of what you're responsible for paying once you've met your deductible and what the insurance company is responsible for. So if you have an 80-20 plan, that means that once you've met your deductible, you're responsible for 20% of your medical expenses. Now, one of the most important things I think anybody should know about their health insurance policy is what is the out-of-pocket maximum. And that's because the out-of-pocket maximum is theoretically, in the worst case scenario, the most you're going to pay out of pocket per year. So how do you get to that out-of-pocket maximum? Well, it does in fact depend on what type of plan you have, but let's just assume for the sake of ease that you have a marketplace plan. The way that you get to your out-of-pocket maximum is by adding up everything you've paid towards your deductible, everything you've paid towards your copayment, and everything you've paid towards your coinsurance. So it's everything you're paying out of pocket except those monthly premiums. Now, usually they're only going to count payments made for in-network services. I also mentioned that it's going to depend plan to plan because we know that some employer plans are actually carving out some of these pieces. So for example, my plan doesn't count co-payments into the out-of-pocket maximum, but it does count deductibles and co-insurance. So it is important for you to understand what your out-of-pocket maximum is and how your particular plan calculates it. So here is an example of how this all works. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80/20 co-insurance and an $8,000 out-of-pocket maximum. Dan gets into an accident and ends up with a $102,000 hospital bill. And let's assume that Dan hasn't had any other medical care for the year yet. What does he have to pay? So the very first thing we always have to pay is that deductible. So he pays that, it leaves $100,000 left of the bill. Remember, he has a 20% co-insurance. So 20% of $100,000 is $20,000. But does he have to pay that whole $20,000? The answer is no, because he has that out-of-pocket maximum of $8,000. So he's already paid $2,000 towards his deductible. So he just has to pay another $6,000 to get to that $8,000 out-of-pocket max. Now, I am not suggesting that $8,000 is not a lot of money. Of course it is. But when we stop and look at the alternatives, it illustrates how important those out-of-pocket maximums are, because otherwise he would have been paying $20,000 without the out-of-pocket maximum, or $102,000 without health insurance at all. Now, if you would like to hear that, any of that, again, the terms or this example, or you think somebody you know might benefit from hearing that information, that is included in our health insurance basics animated video. And again, that's available in English and Spanish with Tagalog subtitles. Now, unfortunately, or maybe fortunately, depending on how you look at it, picking a plan is not a one-time chore. It's actually something that we need to do every single year. And when we're looking at plans, we need to understand what the different plans offer and what our needs are. Now, when I say we need to do that every single year, that's because every single year there are periods of time when you can purchase a plan depending on the type of plan you're purchasing. So if you are interested in purchasing a marketplace plan through the Affordable Care Act's marketplaces, there is an annual open enrollment period in the fall. And I apologize, there's actually a typo on the slide. So a couple of things I want to note about this. Open enrollment for 2021 was in the fall of 2020 and plans started January 1st. However, in response to the pandemic, President Biden actually reopened, or I guess HHS reopened the marketplaces for a special enrollment period that started February 15th and will go until May 15th. And those dates are for all of the states that have federally run marketplaces. So if you go to healthcare.gov, you can actually enroll in a plan right now if you don't have insurance, or if you have a plan and you figured out maybe it doesn't meet your needs or it doesn't have the doctors in network that you want, this is actually an opportunity for you to go and change plans. So I've spent a lot of time in the last couple of weeks talking to healthcare providers, trying to help patients find health insurance options. And this is an unprecedented opportunity. So at Triage Cancer, we're trying to shout it from the rooftops because we want people to know about this opportunity to get insurance now. Now, the typo in this next line is it should say 2022 marketplace open enrollment will be sometime in the fall. Now, I put a bunch of question marks because we don't know what HHS is going to do this year. When the Affordable Care Act was first passed, we had a 12-week open enrollment period. The Trump administration cut that down to 6 weeks. So it's unclear where it's going to be for this year, but certainly stay tuned, follow us on social media, check out our blog, and as soon as we have a date, we will let you know. Now, if somebody has Medicare, they have an annual open enrollment as well in the fall. And then employer plans vary, but most employers, many employers, also have a fall open enrollment so that it can coincide with a calendar year start date. Now, I fully recognize that figuring out how to pick health insurance and how do you make those choices and all of this is complicated. The message I want to leave you with is it's actually easier than it seems, and we have tons of resources to help you. So we have recorded webinars on both Medicare and how to choose and use your health insurance. We actually even have an animated video on how to pick a plan. We have quick guides on all of this. And so if you are struggling with trying to figure out if you have the right health insurance plan, please take a look at those resources. Now, another type of insurance that's very useful is life insurance. So life insurance is insurance that you can buy to provide a specific amount of money to a person or people in the event of your death. And the main purpose of life insurance is that you pay for it during your lifetime to ensure that your loved ones are taken care of financially. When we talk about the beneficiary, that's the person who benefits from the policy. That's the person who's going to get the money. Now, it could be literally anybody. So your children, your spouse, family members, it could be a charity, it could benefit your estate, and it could be split among many people. So for example, my life insurance policy is split between my 2 minor children. Now, when we talk about buying health insurance, I often get asked, well, how much is necessary? And the answer is always, it depends. It depends on what your family's needs are. One strategy is to buy enough coverage to at least cover 1 year of living expenses. Or if you have a mortgage on your home with a spouse, enough life insurance to cover the mortgage if you were to pass away. Some people only choose to buy life insurance to cover funeral expenses. So once you buy a policy, it is valuable to review that coverage once a year to make sure that it's still meeting your needs. So for example, do you have enough to meet your current expenses, or have there been changes in your family? Like, have you had another child? And so should that child be added to the policy? Similarly for grandchildren. And you can make changes to your beneficiaries at any time. Now, there are actually several types of life insurance, but these are the 2 main types. So it's term and permanent. Term is where you pay a premium and it's for a specific amount of time, like 10 years. And if you die during that 10 years, your beneficiary ends up getting paid. Term life insurance is the most affordable, but it doesn't build any cash value over time. And after that 10 years, you would just lose it unless you renewed it. Permanent life insurance is a little bit different because the way it works is that you put a portion of your premiums into an account, and that's known as the cash value of your policy. And that actually earns interest. What is sometimes valuable about these permanent life insurance policies is that you actually can borrow against the value if needed. The downside is that it depends on the market. So if the market isn't doing well, your policy isn't going to be doing well. Permanent life insurance policies are more expensive than term policies, but they also have those additional benefits. And even within permanent life insurance, there are a whole host of types that you can buy, like whole and variable. When you are thinking about getting life insurance, the companies will go through a process called medical underwriting. And that's the process where they collect information from you to figure out how much they're going to charge you for the policy. And it could include a medical exam. It could just be a verbal survey. And unfortunately, life insurance policies are able to deny selling somebody a policy based on a pre-existing condition. And so that can be a challenge for somebody who's been diagnosed with cancer, but it is not impossible. When you're thinking about buying life insurance, there are, again, several places you could go. So you could go straight to the insurance company. Some employers offer a benefit up to a certain amount, and that might not include medical underwriting. And then again, thinking about what other types of groups that you belong to that might be an avenue to access life insurance. So credit unions or alumni associations. If you have a pre-existing condition and find it difficult to find a policy, there are some strategies to find a policy. Now, I will admit these are not all perfect, but again, they're just ideas to get you thinking. So every company has their own rules, and it's valuable to shop around to see if you can find the coverage that meets your needs. If after shopping around, you still can't find a policy that works for you, one option might be something called a guaranteed issue policy. And again, the specifics are going to vary plan to plan, but typically they're for people between 50 and 85. And as the name suggests, you are guaranteed issue, meaning that you cannot be denied. Now, typically these plans are going to be expensive, and they're only going to provide a limited amount of coverage, so somewhere between $5,000 to $25,000. But the premiums are also guaranteed not to increase. So these could be a really good option for somebody who's concerned about saddling their loved ones with funeral costs or credit card debt that could be dealt with this amount of money. So we've gone over health insurance and life insurance, switching gears now to disability insurance. When somebody's diagnosed with cancer, there is often a good chance that there's going to be a point in time when they need to stop working. And that could be a short amount of time, or that could be a long amount of time. And if that time is extensive, most people are going to have to find a way to make up for the fact that they're not bringing home a paycheck anymore. And this is where disability insurance can be incredibly helpful. Disability insurance is designed to replace a portion of your income that you lose because you can't work due to your medical condition. Now, that portion is going to vary greatly depending on the plan. So we've seen disability insurance plans cover anything from 45 to 90%. In my over a decade of doing this work, I've come across one plan that covers 100%. But what's helpful about these disability plans is it's going to pay for the expenses that health insurance don't cover, like your housing expenses or basic needs. There are several different types of disability insurance. The first is a private policy. So that's one that you would go and either purchase yourself directly from a company, or it would be one that you would get through an employer as an employee benefit. With private policies, there are short and long-term options. Again, the specifics are going to vary greatly from plan to plan, but short-term is generally 6 months. Long-term is generally for something over 12 months. And some people might have both a short-term and a long-term. If you have one of these private plans, there are some very important things to understand about your plan, including how does the policy define disability? Are there waiting periods? Does it require you to apply for other type of coverage like SSDI? So if you have a private plan, it's really helpful to get that documentation sooner rather than later, just so that you would know what you would be eligible for. Now, there are a handful of states that offer state disability insurance, and these are short-term disability benefits that are paid for by people's contributions through payroll taxes. So if you live in one of these states and want more information, we have that on our chart of state laws. And then we also have the contact information on our state resources page. And we have a quick guide that goes over the details of each program. Now, finally, the federal options. There are two long-term disability insurance programs run by the Social Security Administration. They are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. Now, based on time, we don't have time to do a deep dive, but the good news is, as you can see, we have a plethora of resources to help people understand the Social Security Administration's disability insurance programs. So switching gears to some of the more practical pieces around managing finances and medical bills, because even if somebody has all the appropriate insurance policies, there are still going to be medical bills and there are still going to need to be some managing of finances. One of the challenges that I tend to come across in the cancer community is there is a very strong emotional connection to financial struggles. And that typically manifests in fear, shame, embarrassment, anxiety, depression. And unfortunately, it's not even just about the person who's dealing with the medical debt, but we know that there is a ripple effect and that it can impact marriages and families. But what's so unfortunate about that is that this is not a unique problem. 56 million adults struggle to pay medical bills, and medical bills are still the #1 reason that Americans are filing bankruptcy. So while I completely understand the emotional connection, I want to give people some tools so that they can start to take proactive steps and maybe cope with those pieces. So this is just your reminder that the #1 way to reduce medical bills is to have the right health insurance plan for you, as we've already talked about today. But even if you have an adequate health insurance plan, it's not going to completely eliminate medical bills. And often I know people who are diagnosed are left feeling like this guy saying, you know, my friend told me to avoid any, or excuse me, my doctor told me to avoid any unnecessary stress, so I just didn't open his bill. This is an interesting coping strategy, but definitely not one I recommend. That being said, there are definitely things we can do to reduce the burden of these bills. Believe it or not, negotiating with your providers before care is often very successful. Also, shopping around for tests. When it comes to getting lab work done, not all labs charge the same amount. So get a list of the tests that you're going to perform and shop around for the lowest prices. If you can, try to group follow-up appointments together so that you're only paying one copay for your office visit. I recognize that that's not always possible, but sometimes it's just about asking. There may also be times when you can take a generic drug instead of a brand name drug that might be less expensive, or maybe even a less expensive course of treatment. But if you've never discussed finances with your healthcare team, they might just give you the option that they're used to. Now, I would never want someone to make treatment decisions based purely on the finances, but we want people to think about it and to have a discussion with their healthcare team to see if there are other options. Once somebody's received care, they're probably going to get a ton of correspondence. So just from the insurance company, you could get 3 different pieces of mail. The first one saying, we've gotten a claim. The second one saying, now we're processing it. And then finally, your explanation of benefits. Now, the explanation of benefits is the most important thing for you to keep an eye out because it's going to give us very important information. So this is just an illustration of the types of information that you might find on an EOB. They are often very challenging to decipher because every insurance company presents the information slightly differently. But generally, they should all have at least, this is not a bill in big capital letters somewhere on it. And that's the first indication that this is your explanation of benefits. You'll also be able to see some information about the policyholder and who the claim is for. In this case, the policyholder is Sally, and the bill is for daughter Little. There should be some sort of summary of the claim. So how much was totally billed, how much was approved, and what's the amount that you might be responsible for. Now, there should also be some information about the services related to this particular EOB. In the chart, you'll see a date, a description, a CPT code, the amount billed, the amount not covered. Good EOBs actually have words under the description, but not always. So the moral of the story here is that if you get an EOB and you are not sure what it is for, contact your provider and get that information. There may also be some information on your EOB about how much you've paid towards your deductible and how much you've paid towards out-of-pocket maximums, if that's applicable. And as we've talked about before, keeping an eye on that out-of-pocket maximum can be really helpful. Now, the last piece of information you may get is from the provider, and that's going to be the bill. So this could be from the hospital where you got care, or from the doctor's office, or from the lab company. This is going to be the amount that you're responsible for, but don't take it at face value. Realize that the communications don't always happen in the order I've just laid out. Oftentimes the provider is faster at sending the bill than the insurance company is at processing the claim. So if you just pay that bill as soon as you've gotten it before you get your EOB, you may end up paying more to your provider than you actually owe. So general rule of thumb is you should wait for your EOB before you pay any bills, but communicate with your providers. Don't just ignore the bill until you get the EOB. So my rule of thumb is I call the provider and I say, hi, I got the bill. Just so you know, I still haven't gotten my EOB. Can you move back the due date? Or can you make a note in my file? And typically that's all that's required to make sure that I get that EOB first. And then more often than not, once I've gotten the EOB, I get another bill from the provider for a lower amount that I owe. Now, I strongly recommend that everybody be reviewing their bills for accuracy. Remember, it's human beings that do medical billing, and human beings make mistakes. So if there is a service on there that you don't remember getting, or there's more than you think you got, ask your provider. Ask them to clarify the codes. Ask them for more information. Because when we're talking about financing, we know that mistakes play a role in this as well. Now, if somebody has a really challenging medical bill situation, there are professional bill reviewing services. They all operate slightly differently, but these are just 3 examples. Now, practically speaking, when we're talking about dealing with medical bills, in addition to reviewing them for accuracy, it's important to create an organizational system. This is not an example of a good organizational system. What is? Well, it doesn't really matter. It's whatever's going to work for you. So I've seen people use file folders. I've seen people use 3-ring binders, electronic files. There's pre-built planners that you can purchase. It doesn't matter as long as it's a system that you're going to use. There are also some online services that you can pay for to collect your medical information and store personal documents. We have a couple of webinars archived on our website by a certified professional organizer about dealing with documents and getting organized. They are incredible for anybody, really, even outside of the cancer context. So if you are struggling with all the paper that comes with a serious medical diagnosis, those might be helpful for you. Some other strategies to staying organized is if you have a smartphone or tablet or computer, use that to your advantage. So some of the ways to do that are keep a file, a folder in your email for anything related to medical issues. When you get tests, ask that the results be sent to you too by email, and then just go ahead and save it in that file. Also, any communications you have with providers or billing departments via email can just all get put in that file so that if you ever have to go back and look for something, it's there, it's searchable. Some other tips are to type up a list of your medications, including the dosages and any vitamins or supplements that you're taking, and email that to yourself. Because I know myself, I go to the doctor and they say, okay, tell me everything you're taking. And I can't remember the dosages of every vitamin of everything that I'm taking. So I have that in my email and I pop it up and I can just read it to them. Similarly, it can be helpful to have all of your providers' contact information in one place. Another tip is if you use an electronic calendar, or even if you use a paper one, where you have an appointment with a healthcare provider, in the notes section for that calendar appointment, write down all the questions you have or the things that you want to talk to them about, so that when you're sitting in the office and you only have your 10 or 15 minutes with them, all you have to do is pull that up and there are all of your questions. I also think it can be really helpful to take a picture of your insurance card with your smartphone, so that if you've ever gotten to a doctor's office and you've forgotten your insurance card, you can typically still receive care even if you don't have the physical card. It's also a great tip for traveling if you ever lose your wallet, for example. And while we're on the topic of using technology, there are really great things that are available to us in the palms of our hands. So most of the smartphones now have a place where you can put in emergency information, like an emergency contact or medical conditions, allergies, any medications you're taking. And you can even put in some information about if you have a advanced healthcare directive or a do not resuscitate order. And first responders are trained now to actually look for that information in your phone. In addition to sort of the emergency piece, these phones now and watches and all these wearable devices have some fantastic tools to help us track our health. So things like sleep trackers and food loggers and medication reminders, and even the ability to put in any side effects that we might be experiencing at that point in time. So all of that can be really helpful, because when you might not remember all of the pieces when you get in to talk to your provider, but if it's there with you in the palm of your hand, that can be helpful. So why is it so important to keep track and stay organized? Well, some of the pieces that we recommend you keep track of can be incredibly helpful if you ever have to appeal a decision from a health insurance company, or if you have expenses, because some of those expenses may actually be tax deductible. So speaking of taxes, talk about knowing that you're an adult the first time you have to figure out dealing with your taxes. Taxes, excuse me, we have both federal and state taxes when it comes to income taxes. The Internal Revenue Service, or IRS, is the federal agency that deals with our taxes, and they have a really helpful tool on their website to help people figure out if they have to file a tax return. And this is something that we do every single year. Now, everybody who earns enough taxable income needs to file, but it can also sometimes be helpful to file even if you haven't earned enough, which we'll get to in just a minute. Now, there's often a confusion around what's a deduction and what's a credit. So deductions reduce the amount of your income that will end up being taxable. So for example, let's say you had $55,000 in taxable income and you claim a $1,000 deduction. Your total taxable income is reduced to $54,000 because you subtract the amount of your deduction from your overall taxable income. Now that is different than a credit. A credit reduces the taxes you owe on a dollar for dollar basis. So let's say you have a $1,000 tax credit and you owe $2,000 in taxes. You get to subtract your $1,000 credit and only pay a $1,000 tax bill. As I mentioned, taxes happen every single year. Tax day is April 15th, typically. Sometimes depending on where the 15th lands in the week, they will extend it. There are now options to email or mail in tax forms, and there are lots of different ways to get your taxes handled. So there is the DIY option, like the forms that you download from the IRS and fill in with a pen. There are lots of software and tax prep services like H&R Block comes to mind, but I know there are others, TurboTax. Depending on how complicated your finances are, you might want to consider hiring an accountant or even a tax lawyer if they're really complicated. Now, I mentioned that even if you don't have to file a tax return because you didn't make enough, it may actually be beneficial for you to do that specifically this year for your 2020 taxes. And that's related to COVID and the legislation that was passed around COVID last year. Because if you want to access things like your economic stimulus payment or even your earned income tax or child tax credit, you need to file those taxes. So it is often beneficial to file the tax even if you don't have to. Now, if somebody's in a situation where they owe money to healthcare providers and they are struggling to pay that, try talking to them. Now, the trick with this is talk to them before they turn your bills over to collection agencies, because it's a lot harder for them to deal with or come up with a solution once it's been sent to a collection agency. And it also hurts your credit once it's sent to a collection agency. So if you can't make a payment, ask for more time. Check to see if they're willing to negotiate a payment plan or accept a lower lump sum. You would be surprised how flexible creditors can be, especially if they know that you've faced this financial hardship because of a cancer diagnosis. So the motto for us here is, it can't hurt to try. And I know that it can be embarrassing or hard to go and ask for these things, but remember the statistic I told you earlier. 56 million Americans find themselves in these situations, so you are certainly not alone. Now, one word of warning, please be careful if you are considering paying medical bills by credit card. Most credit card companies have incredibly high interest rates, and so you're probably going to end up spending more than you had to. It's also recommended that you don't take out a loan on your home, like a second mortgage or a home equity line of credit to pay your medical bills, because then if you're unable to pay back that home equity line, they can actually take your home. Now, these strategies aren't just about healthcare providers. They really can work with any creditors that you are having a hard time paying. Now, even if you've had a financial plan prior to your cancer diagnosis, it can be really helpful to stop and take stock of where your finances are right now. So figuring out your financial big picture is going to require some legwork on your part, and it can be really helpful to identify priorities. So maybe your first priority is finding a job. Maybe you are nowhere near that stage because what you need to prioritize right now is opening the stack of bills that you've been too afraid to open. Maybe you're in a place where you're through the deepest part of it and you're ready to start thinking about building up your savings or contributing to a retirement plan. So figuring out your next steps is going to be completely personal to you and your situation. but these are some big picture questions to help you get started. It's also very helpful to understand not just what you want and what you hope for, but what do you actually have access to? So do you have a predictable income? Do you have assets? What type of debt do you have? If you have a lot of debt, is there one type of debt reduction plan that speaks to you over another? So for example, snowball is a term for when you pay off your debt, smallest to largest, while throwing everything that you have at your lowest amount of debt until that one's gone, and then you move to the next one. Whereas, when we talk about avalanche, you're going to be paying the debts with the highest interest rates first, even if they're the biggest amount to pay off. So once you have a sense of the answers to these questions, it can help guide what your next steps are going to be to improve your financial health. I think a very valuable tool to do that is what we call the financial big picture document. Now, I actually think that something like this is helpful for anybody, but what this is it's a spreadsheet. It's downloadable for free on our website. And in the left-hand side under assets, you list all the things that you have that are worth anything. That could be personal property, it could be accounts, it could be savings, it could be a house. On the right-hand side, you list everything you owe, everything. Car loans, student loans, mortgage, medical debt. The spreadsheet will actually calculate your net worth for you if that's important to you. But what's really helpful about this is it gets all of that information into one place. I can't remember the exact number, but there was just a study done that like some astronomical number of Americans don't actually know their total amount of debt because they only look at it in the nuggets. I know I owe this much in student loans or this much in my house, but they don't really know their total debt. The other benefit to this particular document is there are places where you can include account information, contact information, any notes that you might have. So this also becomes a really useful estate planning tool for either your power of attorney or your executor to know all of the things they need to deal with. Now, certainly you're going to want to keep this information in a safe place because they'll have access to all of that information. But even if you don't like the spreadsheet kind of method, write it all down. Get all of that information in one place because until you do that, it's going to be very hard to find a way out. Next step is to create a budget. Now, this is one of the things that I say in many presentations that I fully recognize is so much easier said than done. I absolutely get it. But it's critical to make sure that you are able to either maintain or reestablish financial health. And there's three main steps. The first step is to pick a method. There are so many out there. There are people all over the internet and Pinterest and the news telling you that they have the best method. Guess what? There is no one best method. The best method is the one that you're going to be able to stick to. So is that a cash envelope system? Is that software? Is that an app, a template? Is it just a pen and paper? Once you've figured that out, you need to identify all your income. This should be super easy if you've already created that financial big picture document because it's everything that's going to be in the left-hand column. And then step 3 is to identify all your expenses. This is where things get tricky. So I came up with these 6 kind of big category buckets of what should be included in a budget, but they may or may not make sense for you specifically. But generally, everyone has some sort of expense related to housing. Even if they're living with their parents, do they have to pay a portion of the internet bill? Personal living expenses, this is where I see people really struggle. Because people, when they're creating apps, tend to try to be the best version of themselves rather than the real version of themselves. And what I mean by that is include the things that make life worth living to you. So if your gym membership is the thing that gets you through the week, or your, manicure or haircut, put that into your budget. There's no judgment with budgets. It's just about making sure that you have enough income to cover all of these pieces. Now, I mentioned there are apps that might be useful, and there are literally millions of apps around finances that you can find for smartphones. These are a couple of apps that I personally have played around with and thought were useful. But as you can see, in addition to all costing a little bit different amounts, they have different goals associated with them. So before you pick an app and are committed to it, understand what the goal behind the app is and make sure that that goal matches your goal. So is your goal to budget? Or maybe your goal is to reduce the debt you have. Maybe it's about building up savings. So that step one can be really helpful to narrow down the millions of app choices. But even with all the apps and what you can Google, it can still be really hard to create a budget. And so if you are struggling to do that, I would suggest reaching out for help. And two places to consider going are a consumer credit counseling agency. These are available in all 50 states, and they have both free and paid services. They will help with things like budgeting, or if you have a huge amount of debt, sometimes they can help with debt reduction. They are often the first step in a bankruptcy proceeding, so very helpful entities. You may also want to consider talking with a financial planner. Now, some people think that you have to have, Mark Zuckerberg type money to deal with a financial planner, and that's just not true. Some financial planners will give you a consult for free. But what can be really useful about financial planners is they can look at your big picture with you and help you figure out the tangible steps. So should you be paying more towards loan A or loan B? Or should you be contributing more to your flexible spending account because that's tax-free money? Where are the financial benefits going to be for you? And so I really recommend, if you're kind of lost, to consider one of these two entities. Now, as part of figuring out your financial big picture, it is absolutely imperative to know what your credit looks like. And there are actually two different things you need to check: your credit score and your credit report. A credit score is a 3-digit number that's determined by looking at your financial history. So your debts, your new credit, your length of history, type of credit that you have. Is it all credit cards, or is it diversified? And then that score is used by lenders to predict how financially responsible you are. So the higher the score, the more responsible you are, and the more willing lenders will be to provide lines of credit. And also, it allows you to access lower interest rates typically. But your score is only part of the picture. You also have to look at that credit report. And the items on the report are what the main credit bureaus are going to look at to determine your score. And the reason it's important to look at both and not just focus on that number is you want to make sure that everything is accurate. People are often surprised to learn that their credit might be checked when they rent an apartment, or lease a car, or buy a home, or even get cable television. In addition, some potential employers might conduct background checks, and that could include looking at your credit score. So fortunately, of all the things I'm going to talk about today, this piece is the easiest to take. Each of the 3 national credit bureaus, so Equifax, Experian, and TransUnion, they're actually required to provide you with a free copy of your credit report once every 12 months. And that actually has been changed due to COVID, and they're allowing for once a week credit polling for free. And I think that goes until March. So to get a copy of your report, go to annualcreditreport.com, you put in your information, and then you get that report. Once you get it, make sure everything on there is accurate. Make sure that there aren't things that you don't remember or mistakes. Also look at how old the damaging information is. So credit bureaus are allowed to report negative information for 7 years. So that's like you closed a credit card for less than you owed. That's going to be reported negatively. And bankruptcy information for 10 years. And while I realize that seems like a long time, that could actually be used to your advantage. So let's say you're trying to buy a car, your credit score isn't great, and the interest rate is very high. 6.5 years ago, you closed a credit card for less than you owed, and that impacted your credit score. Well, could you wait 6 more months until that negative information rolls off your report, your score improves, and then the interest rate goes down? Obviously, life doesn't always work this way. The point is, if you understand how these reports work and how your score works, you might be able to make educated decisions to improve your financial health. But even if you've had a challenging situation, your credit isn't where you want it to be, there are absolutely ways to rebuild it. So using credit cards is actually a great way to rebuild it, but making sure you're using them responsibly, filing your taxes, building savings and retirement, and then also using credit cards wisely. So I realize some of this sounds super obvious, but these tips are actually based on real life people that we have talked to over the last 10 years. But don't get a miles card if you don't travel. And rewards cards are only helpful if you're not paying interest on the account. Otherwise, they negate each other. Cards that earn miles and rewards typically have a higher interest rate. So if you typically have a balance on your credit card, those might not be great options for you. Now, dealing with finances in the midst of a cancer diagnosis and treatment, or even when you're experiencing long or late-term side effects like chemo brain, some of these relatively simple tips aren't so simple. And so these are just some things to consider if you are struggling with the practical pieces around your bills. Ultimately, streamline and simplify. So can you set up automatic bill pay? Especially if it is something that you pay every single month, like your cell phone bill. You know exactly how much it's going to be every single month. Set that up automatically. It just gets taken care of. If that doesn't work for you, think about using your bank's online bill pay system. One of the reasons I love these systems is that there's a record right there every time you log on. So if you're like, I can't remember, did I pay the water bill? I don't remember if I paid the water bill. All you have to do is log onto that computer and it'll show you the last time you paid the water bill. If you haven't figured out by now, I'm a fan of things like checklists and spreadsheets, and that is true for bills as well. And this is something I personally use. So I have a spreadsheet that includes every single bill that I have per month and a column for every single month. And as I pay it, I put that number into the spreadsheet. Similarly with the checklist, you check it off as you pay it, because then you can very easily go back and say, did I pay it? Yep, look there, it's checked off. And then you don't end up missing things. If somebody is really struggling, consider a financial power of attorney. And we're going to come back to estate planning in just a few minutes. Now, another part of adulting questions that I get pretty frequently is it better to rent or buy? And certainly that comes with respect to both cars and houses, but specifically around houses, it depends. There are pros and cons to both sides of it. So if you are in the position to purchase a home, the benefits are that you grow equity in that home. The interest that you pay on a mortgage is tax deductible. If you have a disability and you've made modifications to your home to help with that disability, think about like ramps up to the front door or handlebars in the shower. Any modifications you make are yours and they're there forever, or as long as you need them. The downside, you're responsible. You have to do the repairs. You have to come up with a down payment. And houses can sometimes lose value and you could lose money. Flip side, with renting, those repairs, they're somebody else's problem. Sometimes renting is less expensive than buying, but interestingly enough, nationally, we're starting to see those numbers actually even out. There's also a lot more flexibility with renting. So if somebody's in a situation where they don't know if they're going to stay in that city or that state for an extended period of time, renting might be better. Downsides, you're not building equity. You're also at the mercy of a landlord from year to year. So a landlord isn't required to renew a lease. And any modifications that you need to make with respect to your disability, not only do you have to pay for those modifications, but you also typically have to remove them when you move out. So if you have any other questions about housing and modifications and accommodations, we have a webinar that was done in January, recorded on our website. We also have a quick guide as well. Now, in the last couple of minutes with you, I want to talk about thinking creatively about additional sources of money. So certainly financial assistance is available, and we have information about that on Cancer Finances. But I want to talk about some of the sort of lesser known situations. So crowdfunding is an example. So this is where somebody does something like a GoFundMe to enlist the help of friends and family. And while I think that's a great way to engage people, there are some challenges that we want people to consider. So thinking through disclosure, understanding how a lump sum of funds is going to impact other programs, like are they on Medicaid, and are there solutions? And we have all of that listed out in our crowdfunding quick guide. If you're struggling to come up with cash quickly, I would suggest looking around. So many of us have items in our homes that we are no longer using and would actually benefit from having the money instead of the item. And so these are just some ideas to get you thinking about, are there sources of income right under your own roof? And I am not endorsing any of these particular websites. These were just some ideas, again, to get you thinking. Now, there are few things that really signify being an adult as acutely as realizing that you're not immortal. And that's where estate planning comes into play. Now, when we talk about estate planning, it's really the biggest term for creating a plan in which you document your wishes for your property, for what you want to have happen to your children, and for what you want to have happen to your health care, either if you pass away or if you're unable to express those wishes for yourself. Now, there's a general misconception that you have to be incredibly wealthy to need an estate plan. But the reality is even most people can benefit from having a basic estate plan in place. And even if somebody's under the age of 18 and isn't legally allowed to make an estate plan, if they have a cancer diagnosis, it can be helpful for them to document their wishes as well. Now, I recognize that it can be challenging to discuss issues of mortality and finances, but creating an estate plan can give you the opportunity to express your deeply held values and personal preferences. It can also be the best way to protect your family and your loved ones from having to make really challenging decisions. So I see it as a really loving thing to do. And finally, preparing ahead can give you that peace of mind that your loved ones know your wishes and that there aren't any loose ends. Now, there are lots of documents that might make up an estate plan. These are some of the most common, and I'm going to briefly talk about one of them, but please know, again, on our estate planning topics page, we have more details about all of this, and we also have a recorded webinar on estate planning. Now, one of those documents that I think everybody should have is an advanced healthcare directive. This is a document in which you can both document your wishes for your healthcare and appoint an agent in the event that you are alive but unable to express those wishes yourself. So think about if you get in a horrible car accident and you're in a coma, what are your wishes for healthcare? Now, as I mentioned, you can write down your wishes. You can appoint somebody to make decisions for you. That person is often called a healthcare proxy or healthcare agent. You could just write down your wishes. You could just have an agent, or you could have both. You can also include information about resuscitation and organ donation. So very, very helpful document that I think all of us should have. But the document is only one piece. You have to have conversations with your loved ones about your decisions and make sure that they can access all the things that they need to be able to access. So that means don't create an advanced healthcare directive and put it in a safety deposit box that only you know about, only you have the key to. That is not helpful. So in our animated videos, we just released 2 new videos that talk a little bit more about these practical pieces around estate planning. But big picture, we want people to create an estate plan that works for them and to make sure that they're checking in on that estate plan every so often to make sure it still meets their needs and their wishes. Now, switching gears to the last thing I want to talk about today is disclosure. One of the most common questions we get is, do I have to tell fill in the blank about my cancer diagnosis? So my employer, my loved one, the person I'm dating. And the answer is generally no, especially when it comes to an employer. You're not required to give them medical information. But that being said, you might have to disclose some information to access certain legal protections in the employment setting. But I wanted to make sure we talked about disclosure, especially in the adulting context, because it can have a really wide impact. We know it can have an impact in the employment setting and in the housing setting. We also know it can have a huge impact in relationships, and that disclosure is rarely black and white. These decisions evolve and change, but there are a couple of places where inadvertent disclosure happens that we want people to think about. And one of them is social media. One is certainly around crowdfunding, because those are all Googleable. The other place is around participating in cancer camps and adventures. So we are partners with some fantastic organizations that put on these camps and adventures. But what we want people to think about is, be careful about what you're putting on social media or participating in a promotional video if you are concerned about disclosure, because that is going to impact you. It could also impact you if you're out on FMLA or getting disability insurance benefits. Now, the last part of adulting I want to touch on is advocacy. There are many different types of advocacy. We refer to this as our spectrum. But in the cancer context, you may find that personal advocacy is the most important thing. And some ways to engage in personal advocacy include taking advantage of educational opportunities, like coming today, asking questions, talking to your healthcare team, asking for help. But another type of advocacy is tied very closely to the law, which, as you know, is what Triage Cancer spends a lot of time talking about. And that's legislative advocacy. And we think that individuals who have been diagnosed and healthcare professionals are in a fantastic position to be effective advocates. And we know that this administration has already indicated that they want to do quite a bit with respect to healthcare. So if you're interested in legislative advocacy, I encourage you to check out our topics page, maybe watch our webinar and see what things that Triage Cancer as an organization is supporting that's going on right now. Now, certainly the easiest thing that we can all do to be legislative advocates is vote. And I recognize that this might seem really harsh, but I say this to people a lot. You know, if you don't vote, you don't get to complain, because we are so lucky to get to have a say in who our elected officials are, that we should exercise that voice. Now, I realize that I covered a lot and I jumped around a bunch of different topics and it might feel very overwhelming, but remember that, like most things in life, being a successful adult may take some practice, and you may not get all of the things that I've talked about done this year. But asking questions and getting help where needed is definitely a characteristic of a successful adult. And please know that Triage Cancer is here with our resources and our events to help you where you need it. So this is sort of my big picture adulting checklist. So if you are whispering, I am an adult, as you're filling out these forms you don't understand, please reach out for help. So I'm gonna turn it over to Madison to talk to you about the CE requirements while I take a look at the questions in the chat box, but I will get to questions. So
Great,
Madison,
thank you. Thank you so much, Monica, for sharing such wonderful information. Before we get to questions, just want to remind you all of the requirements to receive continuing education credits. So you must have registered online for today's session. If you are listening in on someone else's computer and did not register, you are not eligible for credit. You must have attended the entire webinar, as partial credit will not be awarded. And anyone watching a recording of this webinar is also not eligible for credit. Within 1 week of the webinar, complete the evaluation and post-test, and you must receive a passing grade on the post-test to be eligible for credit. You will receive an email following this webinar and an email tomorrow from Zoom with the evaluation and post-test link. Please note on the evaluation, it asks for your name and email address, and you must include these so that we can certify that you completed the evaluation, and that email address is what we'll use to send you your certificates within 4 weeks. For any other type of professionals here with us today, we are more than happy to provide a general certificate of attendance. Just make sure to indicate that request on your evaluation. And if you have any questions or experience any problems when doing this, please email us at info@triagecancer.org. So after completing the evaluation and post-test, if you see this message on your screen, that means you successfully passed and submitted the post-test. If you see this screen, it means that you did not receive a score of 80% or above. So you'll be given a link that you can copy and paste into a new web browser to retake the post-test. Your evaluation has been submitted, so you don't need to take the evaluation again, but you can retake the post-test.
Okay, thanks, Madison. I just wanted to get through that in case somebody wanted to leave, because I know we might go over just a little bit. So I want to get to the question. So there was a question in the chat box about what does SW mean on the continuing education page. That means social workers. So if you are a social worker looking for continuing education, we do have approval to provide that to you. Okay, so there is a question about, for the 2021 special enrollment period, would plans start the first of the month following enrollment? Yes, if somebody enrolls in the first half of the month. So if somebody picks a plan, let's say March 1st through March 15th, their plan will start April 1st. If they enroll in the second half of the month, it'll start the first of the second following month. So if they enroll March 20th, their plan will start May 1st. So they don't have to wait until the end of the special enrollment period, but it does depend where in the month somebody applies. And again, I know I'm going to harp on this, but if you know anybody who needs access to health insurance, please have them take a look at that marketplace. There was a study released last year that 1/3 of the Americans who do not have health insurance could get a bronze plan for free in the marketplace, which means they are not paying a monthly premium to get that insurance plan. So I think there's just not enough information out there about how valuable these marketplace plans could be. So please feel free to share that information. There's another question about does pulling a credit report yourself impact your score, or is that a myth? So if you do the free annual credit report, that will not impact your score. But if you are pulling your report outside of that or on top of that, it could impact your score. And certainly they're called inquiries typically. If you, let's say you're trying to apply for another credit card, they're gonna look at your report, and that's potentially, that goes into a piece of your overall score, but it's not as detrimental as many people think it is. I will also tell you that in this day and age of hacks and identity thefts, many companies provide this service as a benefit. So for example, a credit card company might provide you with a credit score. Your bank might provide you with credit monitoring. So like I get an email every single month from my bank saying there's been no like unusual activity on your account. So there are many ways to access that information on top of those free 3 ones that you get, but those free ones will not impact your credit score. Can you get an AFLAC type policy after cancer diagnosis? It is possible. So it all sort of depends on type of cancer, treatment length, how long you've been out from active treatment. The longer you're out of active treatment, the easier it is to get a policy. In some cases, you might be able to get the policy, but you're just going to pay more. So I definitely think if somebody's interested, it's worth doing a little bit of legwork just to see what's available to you. And then you can at least make that educated decision about whether or not that's going to be beneficial to you or not. And that goes for life insurance, disability insurance, supplemental insurance. Really, I think it's almost always worth doing the look to see if you can access it. Don't just assume that you're not going to be able to. So I think I got all of the questions, but if I didn't get, if you end up with a question that you didn't ask today or you think of something later, you know that you can always reach out to us at Triage Cancer. So I'll turn it back over to you, Madison.
Thank you everyone for joining us today. We hope that you found this webinar useful and will continue to stay connected with us. Thank you.